In today's video, we'll discuss the reality of government intervention during emergency situations and how certain prescription and over-the-counter medications can be at risk. Understanding this risk is vital for you and your loved ones. Whether it's due to natural disasters, public health emergencies, or civil unrest, history has shown that governmental agencies may take drastic measures to control resources, including medications. In this video, we will outline the types of medications that FEMA may target, why they might do so, and what steps you can take to protect your supplies. You'll learn effective strategies to discreetly store and safeguard your medications, ensuring that you're prepared while prioritizing your health and well-being. We can't afford to be caught unprepared, and awareness is half the battle. So make sure to stay with us as we delve into this essential topic that could impact you when you least expect it. Don't forget to subscribe for more vital information on preparedness and self-sufficiency. Point number 6, antibiotics. In the context of a crisis, antibiotics emerge as one of the most critical medications to have on hand. Their importance is accentuated during situations such as natural disasters, hurricanes, earthquakes, or floods, where access to medical care can become limited and the risks of bacterial infections surge. Injuries sustained during such events, combined with unsanitary conditions, can lead to an increased likelihood of infections that antibiotics are specifically designed to treat. Common antibiotics like amoxicillin, doxycycline, and ciprofloxacin offer broad-spectrum effectiveness against a variety of bacterial pathogens, making them indispensable in emergency preparedness kits. Many individuals choose to stockpile these medications in anticipation of potential crises, recognizing that timely access could mean the difference between a minor ailment and a severe health complication. However, the acquisition and possession of these drugs come with considerations that should not be overlooked. FEMA has strict protocols for managing public health during emergencies, which may include the confiscation of personal stockpiles of antibiotics. This can be concerning for individuals who are proactive in their health preparedness. The agency prioritizes the equitable distribution of medical supplies to prevent outbreaks, so personal supplies can become a target in the face of widespread need. Moreover, individuals who have hoarded antibiotics may find themselves at risk, not only from potential legal scrutiny by FEMA, but also from desperate individuals seeking medications to treat their own or their loved ones' infections. Thus, while it is essential to secure an adequate supply of antibiotics for personal and family health, it is equally important to consider the implications of stockpiling them during crises. Ultimately, the key takeaway is that while antibiotics are essential for managing health during emergencies, awareness of both their critical role and the risks associated with stockpiling is crucial for effective crisis preparedness. Balancing readiness with responsibility can ensure that both individuals and communities are better equipped to handle disasters when they strike. Number 5, painkillers. In times of crisis, the management of pain becomes a critical concern, and this is where painkillers play a significant role. Two categories of pain relief medications, opioids and NSAIDs, stand out due to their action and practical applications. Opioids are powerful pain relievers, including commonly known medications such as OxyContin, Vicodin, and Percocet. These drugs are essential for trauma cases, where severe pain management is necessary. Opioids function by blocking pain signals from reaching the brain, providing much-needed relief in traumatic situations. However, their potency comes with a caveat. They are highly regulated. Given their potential for misuse and the black market demand that often surrounds them, in a crisis, the temptation or need to access opioids illicitly can rise, presenting both ethical and logistical issues for those in need. On the other hand, NSAIDs, which include widely available over-the-counter medications, like ibuprofen, Advil, Motrin, and naproxen Aleve, serve a different purpose. NSAIDs are invaluable for their anti-inflammatory properties and are often used to alleviate pain and reduce fever in less severe conditions. Their accessibility and efficacy make them a staple within household medicine cabinets, especially when medical resources may be limited during a crisis. As crises unfold, managing the availability and distribution of these painkillers becomes increasingly vital. FEMA may need to regulate both opioids and NSAIDs to ensure fair access to medications, especially in severely impacted communities where demand skyrockets. This regulation aims to prevent hoarding and ensure that populations in dire need can access critical medications. Moreover, in an environment where valuable medications are a target for theft or misuse, it becomes essential to consider safety and discretion in storage. Keeping a low profile and securing painkiller supplies helps to mitigate the risk of becoming a target, ensuring that medications remain accessible when needed most. Point number 4, cardiac emergency drugs. In times of crisis, the preparedness of emergency services can significantly influence outcomes during cardiac emergencies. Medications such as epinephrine, amiodarone, atropine, and lidocaine play critical roles in resuscitation scenarios. These agents form a crucial part of the arsenal that emergency responders must have on hand to effectively manage sudden cardiac events. Epinephrine, often found in EpiPens, is a primary drug for treating severe allergic reactions and is crucial during cardiac arrests. Its ability to enhance blood flow during cardiopulmonary resuscitation, CPR, is vital as it increases the chances of a successful resuscitation by ensuring that vital organs receive much-needed blood supply. The importance of this medication cannot be overstated. Without it, the failure to restore circulation can lead to irreversible damage or death. Amiodarone, marketed under names like Cordarone or Pasarone, addresses serious heart rhythm disturbances. It is particularly effective against life-threatening conditions, such as ventricular fibrillation and ventricular tachycardia, making it indispensable in emergency cardiac care. The timely administration of this medication can stabilize heart rhythms, enabling the patient to regain a normal heart function. Atropine is another key player in the cardiac emergency toolkit, specifically used to counteract bradycardia or slow heart rate. By increasing the heart rate to safer levels, atropine ensures that the heart can maintain adequate circulation during critical moments. Lastly, lidocaine offers additional support by stabilizing heart rates and treating ventricular tachycardia. This medication is crucial for managing rhythmic disruptions that could lead to cardiac failure. Given their operational importance, maintaining a consistent supply of these cardiac emergency drugs is essential for agencies like FEMA. During a crisis, the prioritization of these medications can mean the difference between life and death, underscoring the need for individuals and medical professionals to safeguard their supplies against potential government seizure. By understanding the significance of these medications, individuals can better prepare themselves and ensure readiness in the face of emergencies. Point number 3. Antivirals and crisis management. In the context of a crisis, particularly during viral outbreaks and pandemics, the role of antivirals becomes increasingly critical. These medications are not only key to managing symptoms, but also play a pivotal role in controlling the spread of viruses within populations. This makes them a focal point for agencies such as FEMA, which prioritizes public health and rapid response strategies during such emergencies. FEMA's interest in antivirals stems from their potential to mitigate the impact of viral infections on large communities. For instance, antivirals like Tamiflu, oseltamivir, are commonly employed to treat influenza, while acyclovir is effective in managing herpes outbreaks. More recently, remdesivir has received attention for its efficacy in treating severe cases of COVID-19, highlighting the necessity of these drugs in life-threatening situations. However, the redistribution potential of these medications poses a significant challenge for individuals. During an outbreak, FEMA may need to redirect antivirals to high-risk areas, which can lead to personal supplies being confiscated. This creates an environment of uncertainty and risk for those who may be relying on these essential treatments for their health or that of their loved ones. To prepare for a crisis, it is vital to secure your antiviral stock against both government seizure and the potential for desperate acts from those around you. Given the often limited availability of these medications during an outbreak, keeping a discreet and safe supply can mean the difference between life and death. Therefore, individuals are encouraged to manage their resources wisely, ensuring they have the necessary antivirals on hand while being mindful of how to protect them. Furthermore, being discreet about your stockpile is essential, as drawing attention to your supplies can lead to unwanted scrutiny or even attempts to confiscate them. In times of widespread panic, the desperation of others may drive them to seek out medications, making it all the more crucial to be both prepared and discreet. Point number 2, life-saving medications. In times of crisis, the stability and availability of life-saving medications can make the difference between life and death for those who rely on them. These medications are not only essential for managing chronic conditions, but also critical for preventing emergency medical situations that could arise from a lack of access. Among the most crucial medications to consider are insulin for individuals with diabetes, asthma medications for those who suffer from severe respiratory conditions, and epilepsy drugs that help manage seizure disorders. Insulin, such as Humalog or Lantus, plays a vital role in maintaining blood sugar levels for people with type 1 diabetes. During crisis situations, the stress and disruptions can exacerbate control issues, leading to dangerous fluctuations in glucose levels, making access to insulin imperative. Similarly, for asthma patients, medications like albuterol and Flovent serve as lifelines by ensuring they can breathe comfortably, especially during periods of poor air quality or stress. Not having these medications on hand could lead to severe attacks, which are preventable with proper management. Epilepsy drugs, such as levetiracetam and topiramate, are equally critical, preventing seizures that can pose significant health risks. Without consistent availability of these medications, individuals may experience episodes that could lead to injury or hospitalization, further straining medical resources during crises. With FEMA's involvement in the management and distribution of these medications, it's prudent to anticipate their potential seizure and the subsequent disruption of supply chains. Implementing strategies for discreet storage can help protect access to life-saving treatments. It's also wise to communicate regularly with healthcare providers regarding emergency prescriptions and explore options for secure access in alternative locations. By taking proactive measures, individuals can safeguard their medication needs, ensuring they remain prepared and protected during emergencies. Making arrangements now can significantly alleviate the burden during a crisis, ultimately support patient well-being and save lives. 1. High-demand chronic condition medications. In times of crisis, especially during natural disasters or public health emergencies, access to essential medications can become severely limited. The medications used to treat chronic conditions, such as those for hypertension, cholesterol, and diabetes, are particularly targeted due to their high demand and critical role in maintaining health for millions of individuals. Agencies like FEMA may prioritize these medications for redistribution in order to support those in critical need, which raises the importance of understanding how to prepare and protect personal supplies. Hypertension medications, including commonly prescribed drugs like lisinopril and amlodipine, are vital for those suffering from high blood pressure. If these medications are seized or inaccessible, individuals can experience severe health complications. The same goes for cholesterol-lowering statins, such as atorvastatin and simvastatin. The loss of access to these medications can exacerbate health issues and lead to hospitalizations, further straining healthcare resources. Similarly, individuals managing diabetes rely on medications like metformin and glipizide, along with insulin to regulate their blood sugar levels. Without these vital treatments, individuals are at risk for dangerous spikes or drops in sugar levels, which can lead to serious health consequences. This is particularly true in a crisis when stress and uncertainty can further complicate blood sugar management. To mitigate the risk of losing access to these essential medications, it is crucial for individuals to take proactive steps. Creating an emergency supply of medications, coupled with proper storage solutions, can ensure that treatment continues even during emergencies. Furthermore, discreet management techniques may be necessary if the situation leads to resource scarcity or the potential for seizure of personal medications. Understanding the implications of crisis management in relation to chronic condition medications not only prepares individuals but also fosters community resilience. Awareness of these challenges empowers individuals to safeguard their health and reinforces the significance of continuity of care during critical times.